Good afternoon, ladies and gentlemen. My topic today is Publish or Perish, Most Undervalued Surgeon in the History. Several years ago, I was preparing a lecture on the history of vascular access for hemodialysis, and I found that modern hemodialysis is a combination of invention of an artificial kidney machine and also the establishment of stable and practical vascular access. So for the current hemodialysis therapy, hemodialysis machine is important, and also the vascular access is important. The first radiocephalic AV fistula was done in 1965. The first operation was done side-to-side fistula and 35 millimeter anastomosis. Unfortunately, the first case failed due to small vein diameter and too low blood pressure. But after the failure, 14 cases was done and 12 fistula functioned well. So this operation changed the paradigm of AV fistula, and it is called Behcet fistula, and it was published in New England Journal of Medicine. The impact of this AV fistula was huge, and Dr. Scribner from Seattle was the first nephrologist to refer one of his patients from Seattle to New York for the creation of an AV fistula. So you can see the doctors, Cimino, Appel, and Brescia. They published the legendary paper of AV fistula in 1966 NEJM, and here the order of the authors, Brescia, Cimino, Appel, Hovich. Interestingly, Dr. Cimino and Brescia are nephrologists, and actually Dr. Kenneth Appel is the surgeon who did the operation. This is Dr. Kenneth Charles Appel, the surgeon who performed the first radiocephalic fistula for hemodialysis, the surgeon whose name was unfairly forgotten and never associated with the surgical technique that he designed in the 1960s. So I think he's one of the most undervalued surgeons in history. So I think we all know the old medical idiom, publish or perish. So the most dramatic event in the history of vascular access was radiocephalic fistula done by Dr. Appel, but it's called Behcet fistula, not coined by a surgeon's name. So I think it's time to correct the misnomer. So we should call it Appel's fistula or radiocephalic AV fistula. I'd like to show you another case of an undervalued surgeon. Early in this year, European Journal of Vascular and Endovascular Surgery published an editorial entitled A 35-Year-Old History of Stent Grafting and How EVA Conquered the World, written by Ivanchev and Fogelzhang. They describe the world first fenestrate EVA case like this. The first report on the use of fenestrate stent grafts came from interventional radiologists from South Korea in 1996. And they also described that the first fenestrate stent graft to a renal artery is a patient was performed by John Anderson in Adelaide, Australia in 1998. Unfortunately, these are not true. Let's go back to the first fenestrate EVA done in human, published in 1996 in Journal of Vascular Interventional Radiology. The author, Jae-Hyung Park, is an interventional radiologist, and Seung-Kee Min is a vascular surgeon, and both of them are my mentors in Seoul National University Hospital. These are the pictures of Professor Seung-Kee Min, the vascular surgeon, and Professor Jae-Young Park, the interventional radiologist. I think they are also undervalued surgeon and interventionalists. So the fact is they were multidisciplinary team were doing EVAR, vascular surgeons and interventional radiologists. The procedure was done in angio suite with femoral cut down. They reported 2 cases, and the first case was a 40-year-old male with Behcet disease, and he developed pseudoaneurysm in infrarenal aorta, and the pseudoaneurysm was resected and patch repair was done. But unfortunately, 10 months later, pseudoaneurysm recurred at the patch graft site. So reoperation has some risk. They decided to put a stent graft with a fenestrated tubular type. Unfortunately, after 1 year, pseudoaneurysm recurred at the inferior margin of previous stent graft, so they performed another stent graft, now fenestrated taper type. Here you can see the aorta, and on the 5 or 6 o'clock direction there's a big pseudoaneurysm. You can see the IMA is quite big because the SMA and celiac axis are occluded, and the large meandering artery collaterals. So they make a fenestration like this on the back table and deploy the stent graft and successfully occluded the pseudoaneurysm. After 1 year, unfortunately, you can see the recurrence of pseudoaneurysm at the distal margin of the previous stent grafts, and they designed a new fenestrated stent graft like this to occlude the pseudoaneurysm. The stent graft was deployed, and the pseudoaneurysm is occluded, and bilateral iliac flow are preserved. After 2 years, the stent graft was patent with no residual pseudoaneurysm. The second case was a 72-year-old male with asymptomatic AAA, but the aneurysm proximal leg was 5 mm from the right renal artery. So they decided to perform bifurcated stent graft with the fenestration of right renal artery. So the fact is that the first fenestrated EVA to renal artery in human was done in 1996 at Seoul National University Hospital, Seoul. So this story has some lessons. Sometimes the stories are forgotten, but it can be remembered by someone due to the previous report. So once again, publish or perish. You can see a large AAA and the right renal artery and the short proximal leg. So they make a right renal fenestration like this on the back table and deploy the stent graft. And the CT angiogram performed 2 months later showed that the right renal artery is patent and the aneurysm was successfully excluded. There are lots of reasons to publish medical scientific articles to obtain evidences for diagnosis and treatment of diseases and help mankind overcome various diseases. And also education of young vascular surgeons and to obtain a research fund and to promote in an academic career. These are editors emeriti who devoted for the great development of the VSI journal. The aims and scopes of Vascular Specialists International is pursuing a premier journal in the field of vascular surgery and multidisciplinary approach, inviting all vascular specialists and sharing knowledge from all around the world, especially in Asia. And disease characters in different ethnicity and backgrounds are welcome to the journal. So you can visit the homepage of the journal, and many scopes are included. Patient-tailored vascular surgery, oncovascular surgery, and hybrid surgery, physician-modified endografts, and lymphedema and phlebolymphedema and endolymphatic interventions, and other articles dealing with peripheral artery disease, venous thrombosis, vascular access, and therapeutic angiogenesis are welcome to submit to VSI. The Vascular Specialists International welcomes any type of articles to submit, including review article, original article, case report, and technical note and invited commentary, and rapid communications, image of vascular surgery, and letter to the editor. Thank you so much. 감사합니다.